Did you tell Harry that the class is online? Oh, thank you. Here comes. Good morning, Harry. Morning. Oh, yeah, sorry, I don't really feeling good today, so I do it online rather than coming to school. So anyway, this is the last class. Thank you. This is the last class. So we finished the formula, and kind of the time we may have some time, so we go some review. And next week is the final exam. So yeah, I mean, again, organ formula is, if you know, pretty easy, straightforward. If you don't know, you don't know. So basically, if you're prepared good, and yeah, actually formula is the easiest one to take the exam, because acupuncture and foundation is a little bit tricky, some different options, but yeah, formula is very clear. And for the final exam, yeah, I told you that there are many case studies. So the reason I did do that is I want you to kind of figure out the formula based on the pattern, TCM pattern, rather than just signs and symptoms. So a lot of these cases, you have to figure out the patterns and the chief complaint like that. Okay. So yeah, today we will start from the phlegm. So briefly review between the phlegm and damp, because the previous chapter was basically dampness, and yeah, today main topic is phlegm. The phlegm and damp have many similarities, right? They are both heavy, sticky, turbid, and the phlegm dampness is almost always due to spleen Qi deficiency, and phlegm is mainly spleen Qi deficiency, and sometimes the lung and the kidney involved in produce the phlegm. Second thing is that dampness is from exterior nature and interior nature. So dampness, in terms of the origination, it is from exterior, like the wind damp, like a flu, stomach flu, like that. So we use a 호샹증치산, those formulas. Sometimes dampness is attacking as a wind cold damp B syndrome, attacking the channel. So we use like a 두호지승 or the 창어승시탕 or 주안비탕 like that. Well, dampness is from the directly cold damp coming to the interior, causing go to the stomach, large intestine, and uterus. So yeah, this is basically exterior nature, and they are excess. Also, dampness from interior nature that, as we mentioned, that basically from spleen Qi deficiency and flowing downwards, and mostly influencing the lower jaw organs, including liver and gallbladder, bladder, intestines, and uterus. And the main complaint is mainly like a heaviness, right? Heaviness and tired like that. Tongue of the dampness is mainly greasy tongue coating, right? So if there's a heat, greasy yellow tongue coating. If there's a cold, greasy white tongue coating like that. And pulse is if there's excess like damp accumulation, like accumulation, the slippery, thick, white, greasy, cold. If dampness due to, dampness is coming along with deficiency, it's more like a soggy, soft, same thing, or like moderate, like Shannon Baijusen. So yeah, dampness pulse is, so that's why dampness pulse, we're more likely feeling this soggy pulse than slippery pulse. Whereas the phlegm is only interior nature. And mainly spleen G deficiency. So you have spleen generate lung respiratory, right? So this is typical urchin tongue. So we're gonna study today. And they are compared to dampness, they are same. They are both heavy, turbid, sticky, but they are constantly moving along the channel, and easily combined with heat. So they tense lingering the upper jaw. So they can obstruct the heart orifice. That means like the tongue, or even brain, or eyes, etc. Right? So if the phlegm obstruct is upper jaw, one of the main symptoms is dizziness, right? Because they obstruct the clear yang qi going to the upper. So this dizziness is like phlegm is the main cause of dizziness, whereas the dampness is not. So that is one of the good indicator that there's only dampness or phlegm. And phlegm also, if combined with wind, that is like a stroke, right? So wind stroke, wind phlegm. So that is a wind phlegm. Phlegm with a heat and phlegm heat. So we use what like in. Well, phlegm is cold, and cold phlegm. The urchin tongue is also used for the cold phlegm as well. It's a little bit of a modification. Phlegm can also have a dry phlegm. being guaro. And phlegm is the phlegm fluids. Right? One of these formula to treat is a language one. So phlegm, it takes the chi phlegm. That is a Pansha. So phlegm takes many different forms compared to the dampness, and their tongue is mostly greasy. The pulse is mostly slippery and sometimes wiry. It's more solid substance, so that sometimes strongly obstruct the flow of the qi. So that is most of the phlegm, and both of them main treatment is to move the qi. Before, of course, you have to eliminate dampness, transform dampness, like expel the phlegm like that. But the best way to do it is to move the qi. So move the qi means wind. So because phlegm and damp is easily become a problem when they don't move, they are stagnated. So let's say qi stagnation or cold or qi deficiency can easily make this phlegm and damp causing a problem. What I'm saying is that phlegm and damp is not really that bad as long as you have a good metabolism. So if you move the qi and blood, this is like oily substance, the cholesterol thing, right? So we need the cholesterol for a lot of our daily activities. Just we don't need those cholesterols that is kind of clogged, right? So same thing, phlegm and damp. If we cannot eliminate the phlegm and damp because we keep producing phlegm and damp, but as long as our qi and blood are moving good, then they don't bother us, right? So that's why most of this phlegm and damp formula, like Zhuhong, the Chunpi, Muxiang, all those qi moving herb is very critical to eliminate the phlegm and damp. Okay, so let's start with the urchin tongue. Ivy, can you read this one, please?
二陈汤取红乱下，茯苓炙甘草。Coughing with copious white sputum that is easily expectorated. Vocal distension and a stifling sensation in the chest and diaphragm. Palpitation, nausea, vomit, dizziness. A swollen tongue with thick, greasy coating and rolling pulse. Phlegm, damp, due to spleen fail to transform fluids. Many variation, but only 半夏白术天麻汤 has 橘红温胆汤百保和丸藿香正气散半夏白术天麻兵气化痰丸香酥散香酥散。
Okay, so urchin tongue is like we have this so-called flagship formula. Right? Flagship formula means like what is representative of each category, like wind cold, 망왕탕, 구이스탕, like wind heat, yeah, 인차오산, so spleen chi deficiency, like 수증지탕. And in terms of the dampness, the flagship formula for dampness is 핑웨선, and the formula is for the flame is urchentang. This like 수탕, 리준지탕, all of those. So those base formulas is the reason why we say this like a flagship formula, base formula is a lot of other formulas based on this. So just modification from urchentang or 핑웨선 or like 구이즈탕 like that, and they modify from there. So just understanding of urchentang, basically understand most of this flame formula. 주홍, just 주홍 as a 춘피 and the 반샤. So like I don't know, I can draw it good. So let's say you have in hot summer day, you wash your t-shirts and you want to dry, right? So you dry in the string outside. So sunny day. So this sun is like a bansha. It's hot and very dry. 천피, 주홍 is like a wind because without the wind, it's very difficult to dry it. So together with the bansha and 천피, it's very critical factor to dry. Fooling is kind of draining, so it just keep draining. It make it expedite those function of the express the flame. So these three in combination is the perfect combination for the dry flame. And ganchao is part of the string, right? Like this. So this is a very simple but very excellent combination of the herbs to eliminate the flame or express the flame. Okay. So if there's a flame, this is most like a excuse me, flame in the lung, and the cause of this flame is probably like a spleen chi deficiency. So cough with a copious white sputum that is easily expectorate. So this is more like a damp flame. Damp flame is white. This white, not necessarily the really white, but just like not yellow. Okay, so that means there's no heat. Easily expectorate, and focal distension is one of the key symptoms of the phlegm. If you remember, like 반샤 시에신탕, focal distension. So that focal distension means that there's something inside of your body, you cannot feel it. I mean, you cannot touch it because there's nothing, but you only feel it. This focal distension and stifling sensation in the chest and diaphragm, because this phlegm is obstructed in the upper, like a lung, then qi is not circulating freely in the chest area, so you feel like this oppressive sensation in the chest and the diaphragm. And this phlegm obstruct not only obstruct the flow of the lung qi, it also obstruct the regular qi circulation of the heart and the stomach. So if they influence the heart, then there will be a palpitation. If the stomach cannot descend, then nausea, vomit. And the phlegm is the main cause of dizziness. That phlegm obstruct the yang qi, clear yang qi go upper, then patient feel dizziness. So this is kind of a chief manifestation due to phlegm in the lung. The swollen tongue, that is typical phlegm and damp. Or qi or yang deficiency also can be swollen tongue with a thick, greasy, coating and rolling purse. So thick means this is a pre-accumulated phlegm and excess, right? Greasy coating and the rolling purse. This is phlegm damp due to spleen fail to transform phlegm fluids. So Bansha, like urchin tongue, has many variations, but this is kind of a old-time exam style. That what is the variation of the urchin tongue? The only one in this our formula is a Bansha Baiju Tianma tongue, because Bansha Baiju Tianma tongue has a Juhong instead of Chunpi. But all the other formulas, they use Chunpi instead of Juhong. Does it make any difference? No, not we mostly we use a Chunpi instead of Juhong, because Juhong is a little bit better function, but this is like almost twice as expensive and sometimes difficult to find. So we just use the Chunpi. But some weird time. I mean, the examiner make this question. So and then like a Wendan tongue. That all these the formulas that in this category, Wendan tongue, Baohuan, Hoxiangjingqi. Hoxiangmujingqi actually have a urchin tongue and Pingweisan together. The Baijia Baiju Tianma, Qingqihua Tanwan, and Xingsusan. Because the Xingsusan, because this like this is more likely phlegm in the lung. Actually, phlegm produced by the lung. And so this is urchin tongue. What's the acupuncture point for the phlegm? Good acupuncture point for phlegm. If it's phlegm in the lung like this, then you add lung 5. If patient is this phlegm in the lung and cough, then what point would you add? You can add bladder 13. If this is most like caused by phlegm, you can add like a lung 1 from your point. Bladder 13, main point for cough, for any cough, right? Lung 7 is helping kind of circulation of the lung descending, so that's not a bad point. You can still use it. But main point for this excess condition is Ding Chuan. Phlegm in the lung, Ding Chuan. Bladder 13, lung 1. Okay. Any questions? Okay. One sec. Harry, you have any question? Next is Wendan tongue. Okay. Harry, can you read this, please?
子时陈皮至半夏茯苓至甘草 dizziness, vertigo, nausea, vomit, insomnia, palpitation, anxiety, indeterminate numbing hunger, or seizure accompanied by copious sputum, focal distension of the chest, a bitter taste in the mouth, slight thirst, a greasy yellow tongue coating, rapid pulse, either rolling or string taut, phlegm and stomach, focal distension, copious sputum, a greasy tongue coating, and slippery pulse. Gallbladder heat, bitter taste in the mouth, a yellow tongue coating, rapid rolling or string taut pulse. Phlegm heat, dizziness, and vertigo. Disharmony between stomach and gallbladder with phlegm heat cause heart fire. Neuropsychiatric disorders such as depression, severe insomnia, early stage schizophrenia, psychosis, autonomic dystonia, and the sequelae of stroke.
Okay, thank you. So Wendan is like, again, this is a Chunpi, Bansha, Fuling, Ganchao, yes, the same as Urchin tongue. Right? This 4 is for Urchin tongue. And Juru and Jinshu. So actually this is kind of a interesting name, that this is a warms the gallbladder decoction, but yeah, this one is not really warming. Rather, it's slightly cold, cooling the flame heat. So when spleen qi deficiency have a dampness, and this dampness can easily flow to the stomach. And stomach has a lot of heat, right? The stomach is the organ of the water and the fire, because it's cooking machine, right? So it cooks, and then this heat, the dampness enters the stomach with the heat and easily transforms into the phlegm. And then this dampness of phlegm going down to the liver and gallbladder, gallbladder qi is obstructed, turning to the heat. So combine this dampness, the gallbladder heat and the stomach phlegm, become like a phlegm heat in the stomach and gallbladder. So stomach and gallbladder is in the middle jaw, but they are right below the heart. So the manifestation is actually happens in the heart a lot of times rather than the stomach and gallbladder. So yeah, dizziness, vertigo is main symptoms of the phlegm. Nausea, vomit is for like a stomach phlegm, rebellious qi. And insomnia, palpitation, anxiety. This is all like this heat and the phlegm under the heart, like a stomach, agitate the heart, and spirit. And indeterminate knowing hunger. So yeah, this feels like a hunger because you have a heat, but you're like spleen qi deficiency. You don't really want to eat something. So, and also phlegm and damp is not really helping the the appetite. So they just heat. You're constantly, you hunger but no eat, hunger no eat, like that. Or seizure accompanied by a copious sputum. So this is yes, like like excessive phlegm with the heat generates some wind, causing some seizure condition in severe cases. And focal distension of the chest is again like phlegm is the main cause of the focal distension. Bitter taste in the mouth is gallbladder heat and the slight thirst, but may not want to drink water. So yeah, this is the phlegm heat in the stomach and gallbladder. So because it's heat and greasy yellow tongue coating, rapid pulse with either rolling or string taut. If gallbladder heat is excessive, probably more string taut pulse. While phlegm is more dominant, it's rolling pulse. Sometimes you feel the both quality of perspective at the same time. Right? So this is your phlegm in the stomach, so focal distension, copious sputum, greasy tongue coating, and slippery purse. Gallbladder heat is bitter taste and yellow coating, rapid rolling, and string top purse. And this is phlegm heat causes dizziness and vertigo. Just phlegm, it's not necessarily the heat, but phlegm causes dizziness and vertigo. So this is this harmony between stomach and gallbladder. So you can understand this like a wood and stuff, like a earth imbalance. So yeah, because this phlegm is, so then the phlegm heat is actually influenced heart and going upward to the heart, that may cause neuropsychiatric disorder like depression, severe insomnia, all the stage of schizophrenia, psychosis, like that. So yeah, there was some exam questions that which of the following herb can treat like a schizophrenic patient like that. So yeah, you may choose Wendantang. Okay, it's not the Pingmeisan like that. Well, not Urchantang, but yeah, Wendantang may help this early stage schizophrenia with some modification. All right. So that's one variation of the Urchantang. Just add Juru and Jishi. And next one is a clear heat and transform phlegm. Qingqihua Tanwan. Okay. You with this what the Wendantang? I don't know. You don't know? Let me check. Because Xinjiang data won't be bad, but I don't know if the specifically formula has that in this formula. But let me see. Wendantang, right? You are correct that you add the Xinjiang data grind. So this is they said grind the herb into the powder and prepare as a draft by decocting 1 cup and 5 slices of Xinjiang and 1 pieces of the dazao. Yeah. So probably when you cook, because probably the preparation is they just mix and grind it, and after that grind they cook it. Is formula. Okay. So, because the reason why I add the Xinjiang Dajiao is many times to these two are kind of balancing of yin and yang. Yeah. So in general, Jigan Chao is harmonizing of like especially this kind of like two different group of like herbs is put it together. A lot of times they add ganchao because ganchao can kind of make it in the mediate those the contraindication of the within the formula. And Sengjang Dajiao is actually the main reason for Sengjang Dajiao is Yingwei disharmony. So they can kind of activate the qi for like to helping the not only digest, but they helping the most of the organs to what like settle sort of. And the 승장 is so all these service basically most of the time we want to send the qi, and that is for the 승장's function, and dajao is counterbalancing the 승장's of this the acrid function and calms the mind. So those three 승장, dajao, ganchao is a lot of times they add there, because when I was young, my my parents or my grandparents provide this formula. They just add the 승장, dajao, ganchao together as just for nothing to be harmed, more benefits. But there's some study what specifically use 승장 and dajao and ganchao. It's like I forgot the name of the book. It is like one whole textbook discussing all this. So there's a lot of kind of theories behind it, but I don't know specifically how detailed we choose 승장, dajao when we don't use 승장, dajao. I don't know. Yeah, but good question. You think about it. Okay. Ask Dr. Zheng. He may know. So yeah, that's Wendantang. Next one is a Qingqi Huatan one. Ivy, can you read this one, please?
氢气化糖丸，胆有性或是
单行的。
胆耐性哦，按下花楼人，黄芩、陈皮、杏仁、栀实、茯苓。Coughing of yellow bird. Because that is difficult to expectorate. Vocal distension and a feeling of fullness in the chest and diaphragm. Nausea. In several cases, there may also be difficulty in breathing. A red tongue with a greasy yellow coating and a slippery rapid pulse. Internal clopping of phlegm heat. 定传汤 is released exterior and it emanates phlegm heat. Focus on coughing and wheezing due to phlegm heat due to exterior wind penetrating.
Thank you. So yeah, Qingqi Huatan one is phlegm heat. So like the urchin tongue is phlegm damp. Wendantang is a phlegm heat in the gallbladder and the stomach. And Qingqi Huatan one is phlegm in the lung. So this is more like an infection. Some could be infection in the lung like that. So they still have the Bansha, Chenpi, Fuling here, but they add Dannansing, because Dannansing is from Tiannansing. Tiannansing is very, very hot, warm, very hot herb, but they treat with the bile. So that's why Dan is coming from. So Dannansing is cold and expels the phlegm. And Gualulon is specifically for like a dry phlegm, because it's heat, make it dry. And Huangqin is a clear heat in the upper jaw, and Xingnon can descend the lung qi and eliminate the phlegm. So basically, this is, and Jixi moves the qi. So basically, this is a phlegm heat in the lung, like internal clamping of phlegm heat. So then the sputum is yellow, viscous, sticky sputum that is difficult to expectorate because of heat. And focal distension and a feeling of fullness in the chest and diaphragm, and nausea. So that's all the same. And most of the phlegm in the upper, like the stomach or on the upper jaw, have this focal distension and feeling of this fullest tightness, oppression, the chest and diaphragm, and nausea, vomit, hiccup. In severe cases, there may be difficulty in breathing, because this is more like a severe infection of the lung, and the lung airway is obstructed with a phlegm, thick, sticky phlegm. So red tongue with greasy yellow coating, right, and the slippery rapid pulse. So internal clamping of the phlegm heat. So because the Ding Chuan Tang also phlegm heat in the lung, but Ding Chuan Tang is more wheezing and coughing. From mostly it is starting from exterior nature. So like I'll use the Ma Huang Tang didn't fix it, and the pathogenic factor penetrate quickly to the lung, having this coughing and wheezing and yellow sputum like that. So just kind of process like a Qingqi Huatan one is more internal, generate phlegm from the spleen to the lung, and the heat, whereas the Ding Chuan Tang is from exterior, quickly penetrate the lung, having a heat in the lung, the phlegm. So that's more like a lung phlegm. Okay. Next one. Harry, can you read this one, please?
贝母瓜蒌散，川贝母、瓜蒌、天花粉、茯苓、橘红、桔梗。Cough with deep-seated sputum that is difficult to expectorate, wheezing, a dry and sore throat, a red tongue with little coating, and a rapid and thin but strong pulse. Long, dry phlegm coughing with deep-seated sputum versus 百合固金汤 dryness without phlegm. Long moistening, 川贝母 better than 浙贝母. 天花粉 can cause spontaneous abortion. Threading, rapid but strong pulse versus 生脉散 deficient pulse. Dry phlegm is due to long qi deficiency rather than spleen qi deficiency. 三子养清汤 百芥子、苏子、来附子 indication wheezing, focal distension in the chest, loss of appetite, digestion difficulties, white greasy coating, rolling pulse. Long phlegm coat with qi stagnation. All three herbs are acrid and wormy in nature and are thus able to transform in phlegm coat.
Thank you. Beimu gualosan is called dry phlegm. So they substitute the bansha to beimu and gualo. So and the beimu, you use a chuan beimu here, because the chuan beimu is not only the expels the phlegm, it can nourish the moisture. So that, and gualo, probably use qian gualo, so whole gualo, and the qian huafen, the fuling zhuhong is there. So this is cough with deep-seated sputum. Because deep-seated means it's very difficult to expectorate because they're very dry, right? And stick to the throat. And this dry phlegm is easily caused of wheezing and difficult breathing and makes some noise, and the dry and sore throat because dryness sometimes causes some heat and then it can cause some sore throat. So red tongue with little coating, and the rapid and thin but strong pulse. So this one has not only dry, a little bit of the heat. So this is a long, dry phlegm, coughing, deep-seated sputum. So that the tongue is red with little coating because of dry, and the rapid and thin but strong pulse. So strong pulse is possibly slippery pulse too, and the thin because it's dry and rapid. So this thin is different from the thin pulse that we know of because this is rather explain the pulse quality that come within the because you take the pulse from the patient if the phlegm and damp is wet and more or less cold, then slippery pulse is very wide, slippery. If the phlegm and damp is, especially phlegm is kind of dry like phlegm or indeficiency phlegm, then the slippery pulse, but slippery pulse is a bit thin, thready. So this means that this is a bit thin pulse compared to the other like urchin tongue slippery pulse like that. And long dryness is like this. So this is a dry phlegm, whereas a 발흐구진탕 is just dryness, like a long kidney insufficiency causing lung dryness or lung insufficiency. So they both have a dry cough. 발흐구진탕 also have some like the scanty sputum, difficult to expectorate. But the nature of this 발흐구진탕 is insufficiency and dryness, whereas 베이무구알루산 is dryness and phlegm. Lung moisturing is 추한베이무 is better than 질베이무, so they use 추한베이무. And the 티안화f, and they can cause spontaneous abortion. So be careful with a pregnant woman. And the thready rapid but strong pulse versus 승마이산 is like a lung insufficiency, so just deficiency pulse, because the 승마이산 is more chi and insufficiency. So they're not strong. But this one is excess, like a phlegm. So that is a strong, like a slippery or forceful. And this dry phlegm is due to lung qi deficiency leading to lung insufficiency, like lung dryness, rather than spleen qi deficiency. So that's the 베이무구알로산. So yeah, we have a phlegm damp, phlegm heat, and the dry phlegm. The next one is the cold phlegm, 산지 양친탕, so yeah, by Jeji, Suzu, LEPHerbH12062023. So this is not really Orchentang, the variation, but this is, all of them is very small seeds, right? Sometimes someone use this to add like a tinglizi too. So this is all very small seed, and the old doctors think the small seed can go even deeper to the lungs, like this branch, right? So, for example, urchin tongue is clear the phlegm in the like more thicker to medium level of the phlegm, and sanji yangchin tongue can go deeper. The indication is wheezing, vocal distension in the chest, loss of appetite because it's more cold, and that underlying is spleen qi deficiency, digestion difficulty because it's all kind of cold thing, and the white greasy coating and rolling pulse. So this is a cold phlegm. So lung phlegm cold with qi stagnation, because qi stagnation, again, like qi stagnation obstruct the free flow of the like a phlegm and damp, so easily more condensed. Especially this is cold, and you have to even quickly condense. If the phlegm is not moving, that it going deeper to the lung or bronchial. So all these three herbs are acrid and warming in nature, and are thus able to transform phlegm cold in a more like a more chronic nature, deep-seated phlegm in the lung. Okay. Any questions? And I just read here is one other question about you test how they test, if they test ingredient, how I choose. They don't test that. They don't test, do you add 승장, 다지ao, or ganchao? Yeah, they are not really testing that, so you don't have to worry about that. yeah, very small. Like to me, that when I was in doctoral program, one professor was specifically kind of study that, and it's a really I mean. He has a lot of thought about this, but I'm not really getting it. So if I listen carefully at that time, probably I explain you better. But I kind of, yeah, whatever. And so, all right, let's take a break.
Alcohol and grain, 连父子 flavored rotten smell.
But they are not dry, so that's why they use, right. The first is superficial and long, but and this rolling is phlegm.
受散桔梗
Oh, yeah, so far we okay. Let's continue. Oh, yeah, so far we have like flame damp, flame heat, dry flame, cold flame, that, and the next is wind flame. Harry, can you read this page, please?
半夏白术天麻汤 半夏、天麻、白术、橘红、茯苓、桂枝、生姜、大枣 dizziness or vertigo, a stifling sensation in the chest, nausea, vomit, copious sputum, head feels heavy and cloudy, a white greasy coating and a string-toed rolling pulse, upward disturbance of wind, bad stomach ache, Meniere's disease, 紫绶散、桔梗、荆芥、紫菀、紫苑、贝母、白钱、甘草、陈皮 coughing with or without slight chills or fever. An itchy throat, soft and superficial force, wind attack lungs, sequelae of wind cold, 80 to 90% expelled, coughing due to wind cold, superficial and moderate.
Okay, thank you. So this is the first one is internal wind and second one is external wind. This Bansha Baiju Tiama is like just as we discussed before, Urchantang, Bansha, Juhong, Fuling. And then the Tiama and Baiju is added, but especially a wind is we add Tiama. So this is dizziness or vertigo is the chief complaint because this is where the phlegm is combined with the wind and really like a swelling wind, the upper. So you feel really severe dizziness and vertigo and headache. This is a headache due to phlegm and damp. So usually you feel heaviness, and you feels like my head is falling, very heavy. Stifling sensation in the chest is same thing. Nausea, vomit, same thing. Pure sputum, and head feels heavy and cloudy, foggy like that. So this is wind phlegm and white greasy coating and string top rolling first. So white greasy coating indicates that this may not have a really cold, just normal tongue coating, but normal color with a greasy coating and a wire rolling, a string top and rolling purse. Because of wind, or is it having this caused by internal wind, is caused by liver issue. So wire purse and the rolling is a phlegm. Upward disturbance of wind phlegm. Because wind phlegm always all the time go up, right? And if there's a heat or phlegm heat and the wind, then that is a stroke. So that's more serious condition. But this one is not having a phlegm like a heat, so it's a kind of mild situation compared to the other wind phlegm with the heat that is a stroke condition. Okay? And stomach ache is the important point for like a headache due to phlegm and damp. Okay? And this dizziness and vertigo is the main disease name for dizziness and vertigo. Dizziness or vertigo is the chief complaint. Is Meniere's disease. So, for example, which of the formula can be used for treating the Meniere's disease? Is and Jisosan. So this is interesting formula, and we sometimes patient come with a cough, only cough. But cough is very difficult to treat because as you already see, all this phlegm heat, phlegm cold, damp phlegm, dry phlegm, the chief component is cough. We have also deficiency, lung qi deficiency, like deficiency, or kidney deficiency, or phlegm. Just one second. So that they just cough, then a lot of the old patient has a insufficiency cough. Sometimes just with like a mostly lung in or phlegm in the lung. But the solution is that when asked when this cough starting, and the good clue is that I had a cold last week. I feel better, but I just keep having this cough, itchy throat, trickish throat, because the itchiness means wind. So that this is like after wind attack, then wind cold is like 80-90% expelled. So you may not have any signs and symptoms of exterior, but only cough left. So like itchy, trickly cough, that creates a cough. So this is cough due to wind cold, a sequel of the wind cold. So this is an exterior wind, right? The first is superficial and moderate. It's not really slippery because this is phlegm is not really an issue, but the very kind of a small, very scanty phlegm that attached to the throat, and that triggers the agitate the throat and create the cough. So that is Jisosan. So Jiwan, Baibu, Baichen. Yeah, this is all like a transformed phlegm. But they are not dry. So that's why they use these herbs to stop cough. Okay. So yeah, that's the old phlegm, and then another kind of the variation of the phlegm is the foot stagnation. Ivy, can you read this page, please?
饱和丸生在生菊，莲附子、陈皮、半夏、茯苓、连翘。Vocal distension and fullness in the chest and epigastrial abdominal distension with occasional pain. Rotten smelling bleaching. Acid regurgitation. Nausea and vomiting. Aversion to food. Yellow, greasy coating and rolling pulse. There may be diarrhea. Sanza, especially meat and fatty food. 神曲 alcohol and grain. 莲附子 phlegm from stagnant grain or any food, especially children. 麦芽 is not a part of the formula. Digest grain. Stomach 36, run 12, PC 6, stomach 44, inner 19.
Okay, thank you. The powerful one is the foot stagnation. So this foot stagnation is different from. This is sometimes confusing with the Yejuan. So the Yejuan foot stagnation is that this foot stagnation is due to liver qi stagnation. And this Bahuan's food stagnation is probably you eat too much compared to your capacity to digest. So this is focal distension and fullness in the chest and epigastrium is the same character of phlegm, right? Because you have this like a bansha chimpi fooling is there. So, and the abdominal distension and fullness with occasional pain. Because the food is stuffy, the lack of circulation may cause some pain. Rotten smelling and belching. So rotten smelling belching is that there's a heat. Because it's kind of rotten because the food is not digested and it stay there. And again, your stomach has a lot of water and the heat. So this can easily decay the food inside. As to regurgitation is that now stomach is not functioning properly to descend, they go up. But still, there's a lot of food, there's a lot of acid too. So there's acid regurgitation. Nausea, vomit, and aversion to food. Right? You don't like food. So yellow, greasy coating and rolling press. So yellow, greasy coating means that it's like it's not really necessarily the heat, but again, this the food is decaying. When the food is something is decayed, then there's always some heat, so like infection. So that's why this coating is yellow. But the pulse may not be rapid, and there may be diarrhea, or sometimes constipation. So yeah, shanja is the chief herb here. Then shanja is especially effective to treat the greasy food, meat and fatty food. Shenchu is for alcohol and grain. Like futsu is like a grain food for especially children. So they add those like digestive herbs. And then the root cause of this food stagnation is phlegm, so it has urchin tongue there. And the lian chao is like those heat, right? And vent the heat. Maya is good for digestive grain, but it's not part of this formula because Shenchu can take care of that as well. So we have been look at this herb shanja and chenchu. You have a party, like have a lot of drinking and barbecue, and food stagnation, probably, yeah. So for acupuncture, yeah, that's the point for stagnation, right? So this food stagnation is only one formula. Next is more of those abscesses, those ulcers due to some toxicity. Okay, Harry, can you read this page, please?
五味消毒饮，净化蒲公英，紫花地丁月，野菊花，然后紫背天葵。Indication: all types of boils and carbuncles with localized erythema, swelling, heat, and pain, accompanied by fever chills. Especially useful for deep-rooted and hard lesions, which are said to resemble nails or chestnuts. A red tongue with a yellow coating and a rabbit paws. This is fire toxin, which can arise from a variety of causes: externally contracted heat from a warm pathogen disease, seasonal pathogenic influence accumulating in the organs or channels, overindulgence in rich or spicy foods, or heat that accumulates because of disharmony in any of the internal organs. Heat causes stagnation, which produces more accumulation, in turn generating more heat. As this cycle continues, the fire toxin deepens and gradually forms a very hard root sore, 丁疮.
So yeah, this is one of those toxic skin boils or the carbuncles. And Jininhua, Pugonging, Jiwa, this typo, actually those no H, right? Zi, Jiwa, Diding, and Ye Juwa, the Tianhui. So yeah, this is all like a toxic, clear heat and eliminate toxicity herbs category. So yeah, they're all pretty strong we call it Jininhua, like in Inchaoshan there. Pugonging is for breast abscess. Jihuadiding is good for, they use these days for like a stomach cancer. And Yejua is another like the toxicity herb and the benefits to the eyes. So yeah, this is all 5 herbs specifically they're toxic for upper and middle and lower. So these all types of boils and carbuncles with the localized erythema, swelling, heat, and pain accompanied by fever, chills, especially useful for deep-rooted and hard lesions, which are said to resemble names like chestnuts. And this can be also contagious. So probably we're not going to use this. Like we probably go to the doctor's office and take off in surgery rather than using this formula. But yeah, just remember, because I don't think it's really important formula. But yeah, this is basically this toxic heat is, again, our body, if there's an excess heat in our body, then they tends to expel through the skin. And that is the cause of the skin problem, especially heat is excessive. It's like boils or carbuncles or furuncles like that. And all these areas are red and painful and swollen like erythema. So that this fire toxin is variety of causes. So now can external constricted heat from a warm pathogen disease, wembing in like so this is very like a yang in nature, very excess, like a wave level or chill level. Seasonal pathogenic influence accumulating the organs and channels. So yeah, this is also like a exterior wind infection. And internally, maybe eat too much of a rich and spicy food. They all generate the heat internally. So yeah, it can cause any like internally, externally, channel, organ. Yeah, you may use this. But again, this is more effective in old days rather than the modern treatment. And next one is the IV. Can you read this one, please?
羊河汤，生地黄，
六角角，
六椒椒，肉桂，桃姜，白芥子，麻黄，甘草 indication localize painful swellings without a head that blend into the surrounding tissue and don't affect the texture or color of the skin and are not hot to a touch. There is no thirst. The tongue is very pale. The pulse is submerged, thin, and forceless. This formula treats various manifestations of so-called in-type flat abscess. 阴举. These includes not only problems in the flesh and muscles, but also in the joints and as in some types of crane wind. Huh? Wait.
阿修风 like a crane wind, crane wind.
Crane 和气风 which is a swollen and painful knee joint accompanied by wasting of the muscle of the thigh and calf in thigh flat abscess. Usually blood deficiency patient with phlegm or cold, or both, congeal in the discrete area of the muscle. Sinews, bone, or blood vessel, and the yang qi is too weak to discharge them.
So that the uniqueness of this yang hua tang, I think it's more typo, right? Is yang he tang, which is more correct. Is that this is a inju, like a deficiency. So in time is a deficiency type of abscess. So most of the time, this abscess is boils. Yeah, this is more excess heat, right, from infection or internal heat. But this one is a cold and deficiency underlying. And that's why it is pretty tricky to treat because when you have this skin problem, your first treatment method is use some cortisone cream like that to expel. And then this problem goes even deeper, become very chronic. And this indication says localized painful swelling without the head. Because the head means this like a volcano. So there's heat, and usually they have a head to explode, right? But this doesn't have a head. Without a head, they blend into the surrounding tissue. So like it's kind of swelling, kind of pain. Pain is not that severe. It's not hot. So and color is not changing yet, reddish. So you don't really difficult to tell. So surrounding tissue do not affect the texture or color of the skin. Not hard to touch, and no thirst. So, but yeah, there's a localized painful swelling. This tongue is very pale because this is cold and deficiency, and pulse is submerged deep. So this is like a weak pulse, deep, weak pulse. So this treats the like an in type of flat abscess, injury. So this includes this can happen in the flesh and muscle, but also in the joint. So crane, you know what is crane? This bird, a tall bird. Ivy, do you know the crane? So yeah, if you look at the crane's knee, it's kind of red and swollen because it's very thin leg, but the knee is pretty like extruded, right? So that's why its name is from like a crane knee wind. So many times those like after child delivery female have this problem as well, because their knee joint is kidney and the liver area, and if it's yang is deficiency, this is getting weaker, so we have a weak leg, but that this phlegm and the body fluid is swelling there, so become the swollen knee. So which is swollen and painful knee joint accompanied by wasting of the muscle of the thigh and calf. So generally, because yang is deficiency, kidney is deficiency, that your lower limb is weak, the thigh and the calf, but the knee joint is swelling and painful too. So it can be on the muscle or flesh, also on the knee joint. So this is what we call injury. So the cause of this is a blood deficiency patient with phlegm and cold congeals in a discrete area of the muscle, sinew, bone, and blood vessel, and the yang qi is too weak to disperse them. Because that blood qi or yang is or deficiency, and this kind of phlegmy and the body fluid is congested, and become like a rotten, because long term then become more like a bad, turning into bad, and so that's why there's a big pain, but it's hard to cure. Okay, so that is yang he tang. So remember this one, because this is kind of an exception of other like what this LEPHerbH formula. I'm going to correct this typo. Yang he tang, not yang hua tang. Okay, so HE. And this sudi so nourish blood and the yin, and the lu jiao jiao, so nourishes the yang. So they 25 yang in the blood and the yin all together. And the maha is a vent, the like those are, and it contain the heat. Lu jiao jiao is from lurong, right? Lurong is from the live deer. If the deer horn is full, then that is lu jiao, and you extract some ingredient from lu jiao, is lu jiao jiao. So that also tonifies the yang, right? So rogu is more warming, this is more tonifying kidney yang. Okay. This is Harry, can you finish this, please?
味精汤，味精薏仁，冬瓜仁，桃仁 cobblers foul-smelling sputum, which may be streaked with blood, slight fever, mild chest pain, dry scaly skin, a red tongue with greasy yellow coating, a rolling rapid pulse, lung abscess due to wind heat toxin entering the lungs accompanied by phlegm and blood stasis. The combination of heat, phlegm, and blood stasis produces lung abscess. 味精 is a 芦根 stalk. 大黄牡丹皮汤，大黄、芒硝、桃仁、牡丹皮、冬瓜仁 lower abdominal distension and pain, usually on the right, that increases on pressure with rebound tenderness, guarding of the abdominal musculature. There may also be pain in the groin, resembling painful urinary dysfunction without urinary difficulty, that is relieved by flexing the hip and knee, usually on the right, and increases when extending the hip. In addition, there may be a mass in the lower right quadrant of the abdominal and irregular intermittent fever, followed by chills and sweating, a thin yellow and greasy tongue coating, and a slippery rapid pulse. This pattern is one of early-stage intestinal abscess, a condition of excess bacterial clumping of heat and blood, and the pulse is submerged, thin, and forceless.
Okay. So Wei Jing Tang. Wei Jing is the lugun. And lugun is the herb that clear exterior wind heat. Right? So this is basically lung abscess. So lung abscess, they get the lung abscess, and also in kind of a bronchitis and pneumonia like that. They can treat those any excess heat and phlegm in the lung. So cough with foul-smelling sputum. Well, so that means there's heat and phlegm or damp, and the blood means there's heat. Slight fever, mild chest pain, and dry, scaly skin. Because the lung has a heat, they cannot nourish the exterior. So red tongue with greasy yellow coating and rolling and rapid pulse. So that is like this excess phlegm heat in the lung. So lung abscess due to wind heat toxin enters the lung, accompanied by phlegm and blood stasis. So the combination of the heat, phlegm, and blood stasis produce the lung abscess. Yeah, this is can be developed into the cancer too. So Wei-Jing Tang sometimes use the lung cancer as well. And the last one, Da Huang Mu Dan Tang. So when Wei-Jing Tang is for lung, the lung abscess. Da Huang Mu Dan Tang is it's like appendicitis, right? So low abdominal distension and pain, usually on the right lower quadrant, that increase with pressure. The increase with pressure means access condition with rebound tenderness. So rebound tenderness is typical signs of appendicitis. So in your clinic, patient complain about or you help as and you release. Okay. And what is your next step? Do you understand my question? Yeah. Right. Yeah. So yeah, don't you shouldn't treat this patient. Okay, because rebounding pain means that this appendicitis is pretty serious. So yeah, don't try to needle there like that. Because there's a few questions like that. They have some case, and are you going to refer the MD for a reference, right? That's another part of the exam content. So always awake, right? Yeah, so lower abdominal pain, the rebounding pain, and the guarding of the abdominal musculature. There may be pain in the groin, resembling painful urination dysfunction without urinary difficulty. Yeah, that all makes sense. That is relieved by the flexing the hip and knee, usually on the right, because they bend the knee and increase when extend the hip. In addition, there may be a mass in the lower right quadrant of the abdomen and irregular intermittent fever followed by chest and sweating. So thin yellow greasy coating and the slippery and rapid pulse indicates there's like a dampness, clumping in heat in the lower jaw. So this pattern is on early stage of intestinal abscess in condition of excess of interior clumping of heat and the blood, and thus submerged thin and forceless. So yeah, this is the 다황무단탕 is appendicitis. Oh yeah, this usually like a 다황, so 망샤오. So this is like basically what the 跳位承气汤. And the Tauron goes to lower jaw, Mudanpi clear the blood level heat, and Dongbiz is toxic. So there's like what, how many like abscess herbs. So yeah, this is more like a skin internal organ. This is a deficiency, injury. This is lung abscess. This is large intestine abscess. So yeah, that's the, like 162 formula that probably on the exam. Okay. So again, that we're gonna always think about the pattern when you study and memorize these formulas. They're first memorized by the patterns or categories. That I try to put the category in each formulas like this, but within this category, like you give them some title so that you can easily remember. Any questions so far? Oh, because this is an emergency. Means that can be life-threatening or very serious side effect, and we're not supposed to treat this. So, like if the patient is a hypertension crisis level, you cannot treat this. Patient has about stroke, you cannot treat this. So yeah, there's something that you shouldn't treat. You have to refer to MD. I said like I press that there's a rebounding pain while you bend the knee and the stretch, this pain is increased, and yeah, this is all signs that this appendicitis is about to rupture. Because once it ruptures, then it's really serious problem. So yeah, you just refer to MD or go to like emergency right away. Okay, right. So So just briefly, kind of keyword of each formula as much we can go. First, the release exterior like a category that 마황탕, 구이탕. This is exterior wind cold, right? 마황탕 is cold attack. 구이탕 is wind attack. Main difference is the sweating or not. Pulse was superficial, but 마황탕 is superficial and tense. 구이탕 is superficial and soft. Tongue doesn't change. And the Gegentung, yeah, they have like a Tanyang, still yeah, Tanyang, like from Ma Hongtang variation. But like a pathogenic factor is transferred to the Yangming that like means stomach, spleen, and have a diarrhea. So Gegentung, like a stiff neck and back with diarrhea is a key word there. Shaoqing Longtang is exterior wind, cold, with the internal cold, so that wheezing, like what the copious sputum. So this is exterior wind cold with phlegm cold in the lung. Xiangsu-san is a long chest stagnation with cold. So yeah, usually then because chest stagnation, there's some chest stagnation of like distension and lack of appetite, etc. is there, and probably why first. Sangju in Chaosan is wind heat. So Sangju in is more like a cough is the main pattern with eye problem like conjunctivitis. Is in Chaosan is the sore throat. Right? So that's why yes, and also these 5 herbs are common between these two. That you probably better memorize those 5 herbs. And Chaigu Jiejitang is that Taiyang is turning into Yangming. So yeah, this is the Taiyang Yangming simultaneously. The key word is diminishing chills and increasing fever. So yeah. So then if there's like only, so yeah, sorry, this is Taiyang from Yangming, Taiyang to Yangming. So you can have both Yangming and Taiyang together, or the just wording is like increasing fever and diminishing chills, like that. And Sungmai-san is a skin rash due to exterior wind heat. And the Renshen Baidu-san is like a wind cold due to qi deficiency. If there's no qi deficiency, then we delete and add J. Fang Baidu-san. May I ask? Jia Wei Rutang is a kidney insufficiency with exterior wind. So then you probably have like a chills and fever, like a cough, but also you have this like a low back pain, tinnitus, like an insufficiency sign as well, or night sweating like that. So that is exterior wind. And drain downwards, purge. So your dacheng chitang is like a yangming organ pattern, right? So constipation due to excess heat, and the pulse is deep and forceful, right? And the dacheng chitang variation is xiaocheng chitang. There's no mangxiao, so da huang, jishi, and hopo. So yeah, this like the main difference is dacheng chitang pain increase with pressure. That xiaocheng chitang, no, it is not. And as a mangxiao, there's no like the dryness, right? And Taoei Chengqi is the weakest out of the three, that it doesn't have a Jishi and Hopo, just Da Huang and the Mang Xiao. And this is organ and channel of Yangming. So it's like some nose bleeding, gum bleeding like that. Okay? So this is the most strong. This is in between. This is the weakest because this is still Yangming channel. Again, channel problem, that means like we are bleeding in the upper. So gum bleeding and nose bleeding. And the Run Chang one is blood insufficiency, chronic constipation. And the Majiron one is similar to the Da Cheng Chi Tang or Xiao Cheng Chi Tang, but this is chronic nature. So Da Cheng Chi, Xiao Cheng Chi, Taoei Cheng Chi is from exterior wind, penetrating to Yangming. So this is more like acute. Whereas Majirona is chronic, more like a bad diet habit, causing similar like a heat in the stomach, large intestine, but more chronic nature. So you add Majirona, Komaran. And Jichuanjian is a kidney yang deficiency, constipation. So it is like again, this like so you have to. His categories are drained downward. It's like the Da Cheng Chi, Xiao Cheng Chi, Tao Cheng Chi is Yangming, Fu. And the other one is like Ren Cheng one is more underlying deficiency, and Majiron one is excess but chronic, and the Ji Chuanjian is yang deficiency. So sort of like a memorize understand the pattern, and you can easily memorize. And harmonizing, Xiao Chai Fu Tang, always alternate treatment in fever, dry mouth, bitter taste in the mouth, like hypochondrial pain, white purse like that. And the Jiaowei Xiaoyao is there's heat, so side of the tongue is redder, like the rapid purse, rapid and white purse is Jiaowei. Sunisan, liver chi stagnation with the 4-finger cold, right? 14-finger cold. So this is actually this is all variation of the Sunisan. So they're like Chai Hu and the Bai Xiao. And the Xiaoyao San is spleen and the liver disharmony. Liver attack the spleen. You have an excess condition of liver qi stagnation. You have a deficiency condition of spleen qi deficiency. Right? And the Tongxie Yao Fang is liver attack the spleen cause dampness and diarrhea and painful because liver qi is like obstruct the flow of the bowel, so very painful diarrhea due to liver qi stagnation. And Banxia Xie Xin Tang is a cold and heat complex that this patient is underlying stomach cold and deficiency with like the pathogenic heat. So your stomach is conflict with heat and cold, so that the stomach and intestine is not communicating, that you have a nausea, vomit, diarrhea, sudden tunnel diseases with focal distension. So that's why you use Banxia there, right? So Banxia. So Banxia used like focal distension and clumping due to the cold and heat. And you also have Huangnian to clear heat, and you use like a ganjang to warm it. So this is treat both heat and cold and harmonize stomach and large intestine. But the main thing is the focal distension, right? And the Banxia Shishintang, if it is cold and deficiency, tongue coating is yellow because of heat. There's a kind of contradicting signs and symptoms of this. Let's take a break, okay? Okay, let's continue. Clear heat is a lot of clear heat. So probably sometimes it's quite tricky to differentiate between them. So, but yeah, let's see what. Baihutang, no, is a woman. So 위에 시가우탕 is what? It's a chi level heat means the heat is in the lung, and that injures the chi and fluid. So kind of a lurking or hidden heat in the lung. So it's not really it's different from Baihutang. Baihutang, for example, just pour the water, cold water, and extinguish the heat. But the Jie Shigaotang is kind of bring it down to using urination. Qingyingtang is ing level heat. So ing level heat, then you have, especially this is a fever. Ing level is fever is worse at nighttime because it's like a ing time. Huanglianjiedu is probably this is more important, like Baihutang, Huanglianjiedutang. This is what 3 joule heat, upper, middle, lower joule heat. So it's upper is a lot of bleeding and toxic, some like a skin boils, carbuncles, and the dysentery because the damp heat or toxic heat in. So Huanglianjiedutang clears the fire, damp heat, toxic heat in all 3 joule. Zhizhi is there. Wherever Shintang is Dahong is added. So this is more like severe than Huanglianjiedutang in the sense that Huanglianjiedutang is still energy, fire, whereas the Shintang is kind of clumping. So these fires foam, so constipation. So probably this is more stronger. And Fuji Xiaodu in is toxic wind heat in the upper head and face. So some like boils and those things. And Liangge San is this is Xiaocheng Chitang variation, but the problem is more upper, so above the diaphragm, so sore throat and nose bleeding like that. So Qingwen Bairu San is Wenbing toxifier with a chi and blood level. Ma Xing Shigantang is wind heat penetrate to the internally, so heat with the exterior Taiyang turning into Yangming. Xie San is lung heat, heat in the lung, so your skin is hot, and usually underlying is indeficiency, and more like a children's formula. And the Xie Huangshan is this is heat in the spleen, like this like locking fire in the spleen like that. So Xie Baisan, Xie Huangshan is more children's formula. Qingwei-san is toothache due to stomach fire. Nugent is like a similar toothache due to kidney insufficiency fire. So that's a clear difference. Probably Qingwei-san, you can tell like both are toothache, but this one is more foul smell, breathing, and thick yellow coating or thick yellow grease coating, wherever Unigen may not have a coating because it's insufficiency. Right? Dao Chisan is like the urinary difficulty due to heart fire. So this is heart fire transmitted to the bladder via urination, so clear heart fire. And the Longdan Xiegan is the damp heat in the liver and gallbladder, so you have the liver fire in the upper So bitter taste like a red tinged eyes, headache like that, and dampen in the lower, so like your diarrhea, foul smelling stools, like skin rashes, those is dampen in the lower jaw. Also middle jaw like a shingles, like those the skin rashes on the abdomen and hypochondria. And Jojin one is a liver fire, make this liver attack the stomach. So liver and stomach disharmony. That you use the Wujui 6 because this is the controls the liver, but we use Huangnian 1, so clear fire too. So it's better. Liver and stomach disharmony with bitter taste like that. Xiaoyao Tang is dysenteric, where like pus and blood are the same. Pus and blood are the same. Whereas a Baito Wang Tang is dysenteric with like more blood than pus. So this Baito Wang Tang is more heat, and Xiaoyao Tang is probably heat and the dampness is like equal. The thing is that they're not really give you the. But for example, the patient has a dysenteric disorder with blood and pus, with like a red grease yellow coating, rapid pulse. But they're not going to ask you like, is it the Xiaoyao Tang or Baito Wang Tang like that? So there's two. Because it's kind of difficult to. I mean, if you the whole story, maybe you can differentiate that. But just simple like exam cases, it's hard to tell. That you don't really worry too much about like what's real difference, like a joge one joge in, like a yoge one yoge in, like that, right? But you understand the general, like this is like a dysenteric formula, then you can choose Xiaoyao Tang, like that. Qinghao Bieja Tang is this is what ing like a Wenbing ing level heat that like a night fever and morning coolness, right? Qinghao Bieja Tang, night fever and morning coolness. And the Qinggusan is steaming bone diseases, and the Dangui Liuang one is Shaolin level like heat pattern with severe night sweating. Because all like what Huang Qi is there and 6 Wangs, right? Wang and Huang Qi, Wang Bai, Shu Di Wang, Seng Di Wang, like that. So and Huang Qi. So this is due to like a severe kidney and heart fire causing severe night sweating. We use Dangui Liuang. So that's more like a indeficiency heat. And summer heat is Luisan, right? Luisan, this is Huashu 6 and Ganchao 1. And the next is all this thing is more clear. More heat problem. Now is cold. So Dangui Sinitang is a blood deficiency with yang deficiency. So you have a cold and yang deficiency and blood deficiency is cold fingers or cold limbs. Li Zhongwan is like a middle jaw qi deficiency and cold. So this is like a tie-in formula, right? And the Wu Zhu Yu Tang is it's like a vomit, vomit due to cold. So it can be cold like a splint cold. So basically, a middle jaw qi deficiency and cold causing vomit. Xiaojian Tong Tang is the middle jaw qi deficiency and cold, but more deficiency. That intermittent abdominal cramping pain due to deficiency. So Xiaojian Zhong Tang is just variation of the Guizi Tang, and add etam and double the dosage of Baishao. Dajian is also abdominal pain, but this is more acute pain, more severe pain, excruciating pain, because cold is more dominant. Whereas the Shaojian Dongtang is more deficiency is dominant. And Sinitang, kidney yang deficiency, Shenfutang yang collapse. Right? That's warm interior. And the release exterior interior excess is Da Chai Hutang is what this is Xiaoyang disorder with alternating chills and fever with Yangming constipation. So this is Xiaoyang and Yangming together with the constipation. And the Fang Feng Tong Xiong San is that wind heat with underlying internal heat. So wind heat and underlying internal heat or damp heat. So this is one of the obesity formula. And Gugen Huangnian, so Gugen Huangqi Huangnian Tang is this is another dysenteric disorder with Yangming heat. So we have like the Baito Wang Tang. This is a Baito Wang Tang is actually Jueyin stage dysentery. So this is more severe. Xiaoyao Tang, this is dysentery and like more dampness. Whereas Gugen Huangqi Huangnian Tang is a heat caused dysenteric disorder. And then the tonify. So we know Sijinju Tang, Liujinju Tang is Sijinju plus Urchin Tang is Liujinju Tang. Shenning Baijusan is spleen Qi deficiency with dampness, and the diarrhea is main complaint. Right? Buzhong Tang is like a middle jaw qi sinking. Yipeng Fengsan Wei Qi deficiency. Zhenglai San lung qi and yin deficiency. Su Tang liver blood deficiency. Dangyue Bushe Tang like a sudden loss of the blood, have a floating yang. So skin hard to touch. Like Dangui versus Huangqi 5:1 ratio, 30 grams to 6 grams. Xiaoyao Ganchao Tang, muscle cramping. Bajin Tang is what the Siu Tang plus Sujinju Tang together. So this is like 25 spleen qi and liver blood. Sichuan Dabu Tang, add Fuzi Guizi, Huangqi and Rogui to Bajin Tang. Right? So like a qi and blood deficiency is tending towards the yang deficiency. The Sichuan Dabu Tang. And the Guipita, spleen qi deficiency with heart blood deficiency. So if there's a blood deficiency, it's more like a menstruation issues like that. So if blood deficiency causing more like a poor memory, like anxiety like that, probably Guipita like that. Jigan Chao Tang, like palpitation with anxiety, the lung atrophy. So this is a qi and blood deficiency. Taishan Panshi Tang is restless feeder syndrome or habitual miscarriage due to qi and blood deficiency. Yuediwanwan, kidney and liver insufficiency. Du Qi one is like a Yuediwanwan plus wheezing, more like a wheezing, asthma, coughing is with underlying kidney insufficiency. Qi Shu Diangwan is like a eye with insufficiency. Jibai insufficiency heat. Right? Joge 1, 조개원, 조개인, again, like 조개원 is, they have like lujiao or like a guibanjiao, so more kind of animal product, more focus on the essence part of the in, right? Kidney in of essence part, so it shouldn't be used for long term. And 조개인 is like a weaker version of the 조개원. And the dabuin1 is also kidney insufficiency with steaming bone diseases. 이관지연 is kidney insufficiency with liver chi stagnation. And ERG1 is like a kidney insufficiency with early graying hair. So that's probably that's a keyword you may have to remember. 바이흐구진탕 is that there's kidney insufficiency and the lung dryness or lung insufficiency. So that's dry cough, dry thing, but without the phlegm versus bemugualusan with dry phlegm. Shenqihuan is like what? Jinge Shenqihuan, this that Lue Diwan plus foods and guizi. Right? So that's Jin. And the Lu Gui one, Yogui one is add Lu Jiao Jiao. And so that is again essence part of the yang. And Yoguin is weaker version of Yoguin. And Ershentang is the menopause woman with high blood pressure, underlying kidney and kidney yin and kidney yang deficiency with deficiency fire. So this patient is like excess fire in upper and organ deficiency in the lower with hypertension and the menopause. Okay, so that's like a first part of the formula. So the next category is stabilize and binding. So Mulisan is sweating, right? Of sweating of any nature. So you can just modify with any sweating. And use Mulisan. And Zhenren Yangjang is constant diarrhea. Especially underlying is kidney and spleen deficiency like abandonment syndrome. So yeah, pre like chronic this diarrhea problem. Shen one is a 5 o'clock diarrhea. This is due to kidney iron deficiency with the morning break diarrhea. Jinsu Gujing one is a spermatoria due to kidney essence deficiency. And Sang Piao-san is a frequent milk urine of kidney and heart Qi deficiency. And the Shou Taiwan is restless fetus due to kidney deficiency. And the Gu Jing one is that heavy menstruation bleeding due to liver heat, liver fire. So this like a gushing and trickling. And one Tang is a spermatoria. So this, I'm sorry, not like a leukorrhea. Leukorrhea due to spleen deficiency. This is like bleeding due to heat. So Taiwan is a restless fetus syndrome due to kidney deficiency. And then comes the spirit. Tianong Bushindan is like kidney and spleen insufficiency, fire, kidney not communicating. Xuanzao Tang is for like liver insufficiency and causing heart in and blood deficiency, so inability to sleep. Hangnian Euzhao Tang is even worse. That like this is again Shaolin heat level. That severe fire due to kidney and heart disharmony causing this is cannot lie down. So this is worse than Xuanzao Tang. So is irritated. Gamma Dazao like just crying or laughing some his behavior. And the regular the Qi Yue one again this typo that 5 stagnation of qi and blood and heat and food and dampness. So that's Yue one. And the Chaihu Shugantang is liver qi stagnation with the clumping. So that usually have some pain. Right? And some like a swelling like that. Bansha Hoputang is a Meihuchi. Liang Fu one is like liver attack the stomach, and this is cold. So and the pain is painful stomach, but it's better with warmth. Liang Fu one. And the Jinning Disan is liver stagnation with depressive heat, cause the pain in like Shen disorder, lower jaw. Tiantai Wuyao San is cold in the liver channel and excess condition. So your pain is more severe, especially like more lower jaw. Like again, this is another Shen disorder. And the Nuanganjian is cold, same like cold in the liver channel, but this underlies kidney and liver deficiency. So this is more excess condition. This is more deficiency condition. Both are cold, and both can cause Shen disorder. Suju Jiangqi is upper excess, below deficiency. The kidney yang deficiency have a phlegm cold in the upper. Ding Chuan Tang. Ding Chuan Tang is a phlegm heat in the lung, causing wheezing and the cough due to phlegm heat. So this is more like exterior nature. Shanfu Daizi Tang is a phlegm in the stomach, causing nausea, vomit, hiccup like that. And the Jupi Julutang is deficiency of stomach deficiency. It causes nausea, vomit. So Shanfu Daizi Tang is more excess, like a phlegm involved, and this is more like deficiency. And the blood stasis, again, a lot of blood stasis So 타호 청치탕 is this is again Shangannon Taiyang organ, like a Taiyang Fu blood accumulation, the severe abdominal pain with a night fever, and sometimes even manic, like because the heat in the blood can cause some mental problems, so it can be manic like that. And 셰프주의탕 is blood stasis in the chest due to chi stagnation, because this one is like 타홍수탕 plus Nisan. So it is a blood stasis caused by chi deficiency, chi stagnation. 샤프주의탕 is blood stasis in the below the diaphragm, in most organ. So you can the pain and you can feel this this mess in the abdomen. Gusha-Juitang is a Muslim male female patient like uterus due to cold and blood stasis. Shentong-Juitang is a B syndrome with blood stasis, so whole body severe pain. Buyang-Han-Wu-Tang is a blood stasis due to qi deficiency. Cold is good for like after sequel of the stroke. Fu-Yuan-Fu Fo-Xue-Tang is more traumatic pain, especially hypochondriac area. So broken ribs, like fractured ribs, you can use this. Wenjing-Tang is like irregular menses, painful menstruation due to cold, causing a blood stasis. So this cold and blood stasis causing a severe menstruation pain in the lower jaw. But underlying is insufficiency too. And the Shenhua-Tang is after childbirth with a cold and deficiency with blood stasis. Fu-Ling-Wan is a restless fetal syndrome due to blood stasis in the uterus. So this is used for like during the pregnancy. Shi-Shao-San is Wu-Ling's and Fu-Hang, just two for the pain, menstruation pain due to blood stasis. Danshen is blood stasis in the stomach. And Shi-Hui-San is bleeding, the middle jaw and upper jaw due to liver fire. And Xiaoji-Inji is bleeding, like it says blood lin. So if like the UTI, Lin syndrome, this is blood lin. And Huai-Hua-San is hemorrhoid bleeding. And Jiao-Wai-Tang is a blood deficiency causing a cold and bleeding, because this blood is not nourishes the Chung and Run, so Chung and Run is unstable, so heavy bleeding with cold and deficiencies, Jiao-Wai-Tang. So this is all like bleeding due to blood stasis. And the expels wind, so Chuanxiong Chai Tiao San is a headache during the wind cold. Chang'er's San is like wind cold, have nasal congestion. Xiaohu Ludan is like wind cold damp in the channel, so severe pain. Xiao Fengsan is wind damp heat in the skin, so like oozing and itching and there's the skin rashes, hives, urticaria. This is more like an external nature, and Jinganshi Pungtang and Tianma-Wu-Ting is internal liver yang rising, caused by liver and kidney insufficiency. And Jinganshi Pungtang is more excess nature, of like even about like just the precursor of the stroke. So Tianma-Wu-Ting is main complaint is headache due to hypertension. And treat dryness. Qingsu-san is like a dryness, coolness. So Jisuye is used for like wind cold. So this is like a cold dryness, Xingren. whereas the Sangxingtang, Sangye is used for the wind heat, so this warm dryness. Okay. And Qingjiao Ju Feitang is dryness in the lung. So these two are from exterior still. This one is the dryness and enters the lung, have some dryness and heat side in the lung. Maimendongtang is stomach dryness caused lung dryness. So this is similar to the Baihugu Jintang, because both a dry cough, dry throat, dry mouth, like that. But yeah, this one has like more some kind of uncomfortable throat and maybe some nausea, vomiting because it's stomach issue. And Jingyetang is just, it's not like this is more provide the body fluid into the body rather than tonify in. So yeah, that treats the basically dryness. And yeah, Pingwei San, damp accumulation, Shang'an Taiyin formula. San is exterior wind with internally dampness patient. So this one has what you have a Pingwei San, Urchin Tang, and the Sujin Tang is in there. And the San Tang is early stage damp heat. This is more dampness is dominant, right? And the Incheon Hao Tang is jaundice, okay, the yang jaundice. Bajang San is damp heat in the bladder, urinary difficulty, like Lin syndrome. Miao is the dampness in the lower jaw and it can be used for any low jaw damp heat, but also it can enter the muscle and the bone, so can treat the pain due to damp heat in the lower jaw, so low back pain, muscle cramping like that. Wulingsan, this is Taiyang organ pattern with water accumulation. So this is all urinary difficulty, right? Urinary difficulty and vomit. Wulingsan vomit, edema. Julingtang urinary difficulty, but this is heat. So it's desire to drink cold water. So Julingtang is heat. But these two, Wulingsan, Julingtang, three herbs are common. So Wupisan is edema, whole body edema due to spleen Qi deficiency. This is for especially edema during the pregnancy. Lingui Zugantang is the phlegm fluid in the above the diaphragm. So this is thin mucus in the epigastrium. So you can vomit like a watery frothy saliva like that. And Genutang is a kidney, spleen, yang deficiency, and water metabolism disturbance in the lower jaw. So this one is a severe abdominal pain, and urinary retention and the edema, and going to the upper, so palpitation, dizziness, cough, like wheezing, like heart failure, like that. So can be very serious problem. And the Shipin is a whole body edema. Right? Shipin is whole body edema. We call it in edema, so kidney and the spleen yang deficiency edema. And the B-shaped Fun Ching In is this is for milky lean due to kidney indeficiency. And the Changhua Sheng Shi Tang is the dampness in whole body and causing heaviness and pain. So this is wind damp cold in the channels and muscles. So it's not going interior, but so more B syndrome pain due to wind damp cold. And dampness pretty strong, right? And the drumbeat is like a wind cold damp in the upper due to underlying deficiency. 두호지승탕 is wincoldam B in the lower jaw due to kidney yang deficiency. And with 샤오야오지무탕 is a wincoldam with a localized heat. So this is kind of interesting that patient has a general wincoldam, but like a kind of knee or certain part of the body is heat sensation, like a localized heat, swelling and painful because of the constraint of the like a dampness. So that we use squeeze shower. Yeah, so that's we have studied last week, and phlegm, food stagnation, and abscesses for today's. Okay, so I think that's all. Hope to see you next week. So again, the next week is exam, so you don't have to come to the school. We'll take online. Okay. Anything else? Harry, are you coming to the clinic next Tuesday? What, this Saturday? No, intern semester. Because I need your signature because I have to evaluate. And so I need your how many hours in the clinic and how many patients you treat this semester. So yeah, just drop by Saturday morning or Tuesday afternoon. Yeah. So you count your a patient this semester and the hour and the level. Right? So, and then I need your signature as well. Okay. Thank you. So I'll see you next week and see you in the clinic.